Well, my father was my inspiration. He was an orthopedic surgeon. Over the summers as I was growing up in college, I was able to work in his office, putting casts on and helping out. And he definitely inspired me to look into the field. And as I went through medical school and we trial different things, I found that it meshed well with me. And I've always been athletic. We like to treat patients who are active, want to stay active. That's part of what we can do quite well. And so sports injuries, sports medicine. When I was in Texas, actually, I was a team physician for a minor league hockey team, as well as an arena football team. And along the way, we've been team physicians for high schools as well. And we offer a wide variety of things. And one thing about specializing in lower extremities, we do a variety of procedures from arthroscopic surgeries to big traumas, to arthritic conditions, to tendon surgeries, to realignment procedures. There's a wide spectrum of conditions and therefore procedures that we do. When a patient arrives, we try to get to the real reason why they're coming. Is it pain? Is it lack of function? Is it some other reason? And sometimes it requires surgery, and sometimes it does not. But having that conversation and understanding what the patient really is looking for, what problem they need solved, and can we help them with that problem, is what we try to do. And we start off usually by asking some questions, getting a history, and oftentimes we do need x-rays if it's a new visit, depending on the condition, but we certainly need a thorough physical exam as part of that. Whether we do procedures or not, we try to have them understand what we believe is the source of their problem and what we think one of the better solutions might be, and then we try to work together with the patient to come up with a solution that works for them. And then when it comes down to actual procedures, we try to walk them through the entire process of how do you get to the surgery center, what happens when you arrive there, how the surgery is going to go, and what the expectations are for after surgery. Physical therapy is a big part of any postoperative recovery, especially after any kind of athletic condition. We like to get on physical therapy right away. We try to stay in touch with every aspect until the patient is well enough to be discharged. And so what's nice here at Town Center Orthopaedics, we do have physical therapy on site. And oftentimes if the patients are coming here, we have very close interaction with our physical therapists. We like to use surgery when it's appropriate. There are a lot of surgeries we can do, but I think finding the conditions that surgery will be a benefit to that patient is what we like to do. Now, there's one gentleman in particular who was assisting a friend and cleaning out his garage, and he bumped up against a very sharp object and lacerated his leg, which included all his tendons and his nerve, as well as the artery. We were able to correctly diagnose him and then also put everything together, and he's getting good function back from his tendons and even showing some signs of nerve recovery as well. The use of narcotics in my practice has gone way down, where now, and the patients are much more comfortable after surgeries. So that's one of their goals, is to make, if you have to have surgery, to try to make it as clear as possible as to why we're doing it and what's going to happen, but then also try to minimize the pain and discomfort. In my practice, I try to spend as much time as needed to convey the information for each patient. And sometimes it takes a few go-rounds to get the message across, but I think it's important that my goal is, when I see a patient, is to make sure that they understand what I'm trying to say and try to communicate that. I think that listening to the patients and trying to decipher where they're coming from is one of the things we try to do here. It's something that we're constantly trying to improve upon, but it's something that I think is essential to getting to the reason why the patient is here and trying to hear them and hear their concerns as well as what their condition is.